This video will cover reactive mass-like renal lesions that may mimic cancer clinically. To anchor ourselves to this, we have a flag that is telling people to be cautious because these characters are reactive. There are two lesions we're going to talk about. The first one is xanthogranulomatous pyelonephritis. It is represented by the granny character with flank pain standing next to her prescription bottle of Xanny bars. Come on, don't take life so seriously. It's okay to joke. Okay, so putting this together, granny sounds like granulomatous and Xanny sounds like xantho. Since she has flank pain, we're going to remember the pyelonephritis portion of it. It looks like Granny made some nice home-cooked meals. She's made a bowl of mac and cheese with hot dogs and some whipped cream to top it off. The bowl of mac and cheese represents macrophages. The whipped cream, or you could call it foam, represents foamy. Together, you get foamy macrophages. The hot dogs represent the fact that this is commonly associated with recurrent UTIs, specifically those associated with gram-negative bacteria. The next lesion for us to talk about is malakoplakia. This is represented by our character Melissa Duck. Malakoplakia sort of sounds like Melissa Duck. Her yellow car will remind us that malakoplakia can be found anywhere in the GU tract, which produces yellow urine and therefore the yellow car. Our other character here looks like he put on a few pounds. He represents Michaelis-Gutman bodies because Michaelis sounds like Mickey and man has he developed a little bit of a gut. Of course, on the exam they probably won't describe them as Michaelis-Gutman bodies. They would likely say something on the lines of targetoid basophilic calcified inclusions within macrophages. The macrophages are again represented by the mac and cheese, and I put a purple target on the bowl to remind us that these inclusions are targetoid and basophilic. Now let's see what he's saying. Should call a van so I can get to my casa. You see how the words van and casa are highlighted? This is because they sound a lot like von Casa stain, a stain that can highlight Michaelis-Gutman bodies. Malakoplakia is also associated with gram-negative bacteria, which is why there are hot dogs in the mac and cheese. The pathophysiology is that there is defective macrophage lysosomal digestion of phagocytosed bacteria, which I think is accurately represented overall here.